Hi, and welcome to our new podcast series where we sit down with world-leading doctors from across a wide range of medical specialties to explore one of the defining health challenges of our time, the intersection of medicine and climate health. Our mission is simple. We want to raise awareness on how environmental change and poor sustainability practices are already affecting human health, from the air we breathe to the food we eat to the diseases we treat every day. More importantly, we have to have a practical conversation about what we can do to prevent these impacts, not only to ourselves, but also to our families, friends, and future generations so they can live longer lives on a healthier planet. Hi, my name is Manal, and I'm a final year medical student. Join me as we learn from some of the world-leading clinicians, researchers, and experts, one conversation at a time. Today, we're joined by Dr. Fiona Foo, a cardiologist who sits at a fascinating crossroads between the health of your heart and the health of our planet. Dr. Foo is a general and interventional cardiologist based at Macquarie University Hospital in Sydney. She's one of fewer than 20 female interventional cardiologists in all of Australia and one of the first Southeast Asian women to reach that level in this country. Her clinical work focuses on coronary angiography, angioplasty, stents, and preventing heart disease before it starts. But what makes Dr. Foo truly unique is that she takes the science beyond the hospital walls. She's a passionate advocate for understanding how our changing climate and environment are directly damaging our hearts. And she has spent years educating communities, GPs, nurses, and fellow cardiologists about this emerging threat. She founded the Macquarie University Hospital Sustainability Committee and has presented extensively at conferences and public events and has contributed to the Medical Journal of Australia on the topic of climate change and cardiovascular health. She is also the co-vice chair of Doctors for the Environment Australia. We will let her tell you more about that. Dr. Foo, welcome to the show. Thank you so much for being here, and we are absolutely thrilled to have you here.
Thank you so much for inviting me, and yeah, this is a great initiative. Thank you.
Yeah, before we begin, can you tell us a little bit more about yourself? What does a cardiologist actually do, and what made you want to become one?
So I'm a general interventional cardiologist. Essentially, cardiologist looks at diseases of the heart. My subspecialty is coronary intervention, so that's stenting, so coronary angiograms and stenting. But actually, as my career has evolved, I'm doing a lot more prevention, and I pretty much look at all types of general cardiology and treat, prevent disease across the spectrum. So not just coronary artery disease, but heart failure, arrhythmias, all those kind of things. I actually did my physician training in Concord Hospital in Sydney, and I had some really good cardiology rotations. And so they kind of inspired me to kind of think about doing cardiology. And actually one of the main reasons is with cardiology, apart from the fact that it's very interesting, is it's very evidence-based, and it makes sense, unlike the brain. But that you can fix things. So you can people's heart failure can get better. You can open up an artery. You can ablate a rhythm problem. So I think that the ability, the evidence base behind it, but also the ability to actually make a difference was what appealed to me with cardiology.
So you grew up in Malaysia before coming to Australia. How did that journey shape your perspective on medicine and on health?
I think my Malaysian kind of Asian culture is what has shaped me as a doctor. So my mum was a nurse, and so she was a nurse in the geriatrics ward, and she actually kind of told me not to become a doctor because they work too hard. But I think having that culture coming from that Malaysian Chinese background is really important in terms of how I care for patients and my work ethic. But I think the other thing is also, coming from a migrant, being a migrant, you also appreciate how lucky we are in Australia and how good our health system is. We've got one of the best health systems in the world, and we're not paying a fortune for it, unlike some of my relatives in Southeast Asia who, even despite insurance, they're paying tens of thousands of dollars for just to see a cardiologist or get a stent. So I think we have to realise how lucky we are here.
Yeah. At what point did the environment start appearing in your work as a cardiologist? Was there a specific moment in your life that you can sort of hone down on that made you really passionate about the environment?
Yeah, so I think, it actually came back to the Black Summer bushfires. The sky was black. I do a lot of exercise, so, I was like, well, I can't exercise. And this is, that first of all really annoyed me. But then, and then I started looking into, well, I can't exercise outside. This is bad for my health. Imagine what does it do to my patient's health? So then I started reading and looking into the research about climate change, about air pollution, about heat, and all these effects on cardiovascular disease. And I think the more you read about it, the more terrified you are, but also which is what kind of got me to act. And I think the more I read about it, the more I realized how little I knew and how much more there is to know, but also how much the world needed to know, the community needs to know, and how much we need to act on the environment, because it is such a big risk factor for cardiovascular disease.
Okay. So I did some research beforehand about these Black Summer bushfires, just so for the listener that may not know. So these are the bushfires that occurred in 2019-2020. Yep. They had a 4.5% rise in cardiovascular mortality, and there was a 1,124 excess of CVD, cardiovascular disease-related hospitalizations. Now, were you a cardiologist at that point?
Yeah.
Okay, so what did you see in the sort of the health system from a cardiology viewpoint?
In the outpatient clinic, it's mainly the patients that I will be seeing just in the the kind of stable outpatient setting would be the ones that come in, they're short of breath, mm-hmm. they can't go outdoors because they're short of breath if they're exercising in the smoke. Okay, then you also have the issues with heat as well. So you've got the two big issues: the air pollution causing increasing shortness of breath, and we'll go into all these other effects that it can have. So and as you mentioned, you've got increased cardiovascular disease hospitalizations, and the biggest problem is actually ischemic heart disease, so heart attacks. So it increases heart attacks and strokes. And it also can increase rhythm problems like sudden cardiac arrest.
So personally, I struggled really bad with cardiology in my formative years. So to help me and also to jog the listener's memory, can you please give us a quick picture of what the heart actually does and why is it so central to our health? I know.
I know it's huge. So the heart. So the heart's a central pump. It pumps oxygenated blood, so blood and oxygen and nutrients all around the body. So it gives the blood supply to the rest of the organs in the body to make everything function. Okay, so it's that kind of central engine. And so the mechanical or the pumping of the heart. So that's including the heart muscle and how well it pumps. As well as the valves inside the heart. So that's what we call structural heart problems. Then you've got the arteries that supply the heart muscle, and so that's where heart attacks occur, inside the arteries. So there, I get called a plumber because we talk about the plumbing of the heart. And then there's the electrical supply, so that it maintains the heart rate and causes rhythm problems or not. So if you think of it as like an engine where you've got the pump, you've got the plumbing, and you've got the electric, that's the heart, and that's kind of pumping, the blood and the circulation around the system. Okay,
sure. So some might say the heart is a very, very important organ in
Correct.
the human body, and without it, we might not survive. So we're talking about the heart and the environment. So tell me a little bit more about why is the heart particularly sensitive to the changes in our environment, like things like heat, air quality, as well as stress compared to other organs?
So if you think of it as a heart being central to our whole cardiovascular system and all our organ system, it also regulates temperature and pressure, blood pressure, sorry. So when it's under these environmental stresses, it has to work harder. Right, so it has to work harder to maintain your blood pressure, maintain your heart rate, maintain the blood flow around. So it contracts more. So, for example, in heat situations, it has to work harder. So you have increased heart rate and contractility. Then other issues can cause increasing inflammation that can cause coagulability and thrombosis and acute cardiac events. Essentially, all these stresses make your heart work harder. And through different mechanisms, these environmental stresses can increase risk of cardiovascular disease, morbidity and mortality. So I guess that's the bottom line, yeah.
Sure. So now let's move on to the next segment of our talk, which is sort of talking a little bit more about the air pollution and heart disease.
Yeah.
So there are these sort of tiny particles that cross from the lungs into our bloodstream and trigger inflammation. That's particularly bad for our heart, and that's called pollution. And so we hear that it's really bad for our lungs. Pollution is really bad for our lungs, and it's sort of sensationalized all around the world, especially in the media and the scientific community. But there's also some sort of backlash to those statements, even though it's very much scientifically proven that it is quite bad for us.
Yeah.
But the connection to the heart is less well known. So can you walk us through how polluted air actually damages the cardiovascular system?
Okay, so I think, one thing I think is really important for people to realize, and there is that lack of knowledge of this, is that air pollution is actually a significant risk factor for cardiovascular disease. It's actually the leading environmental risk factor for cardiovascular disease, and it's up there in terms of top 5 modifiable risk factors for cardiovascular disease. It actually causes more cardiovascular deaths than smoking. Right, and that, which is, that's a big deal, right? And as you say, so air pollution is composed of a number of different constituents. So one is particulate matter, and PM particulate matter 2.5. So it's 2.5 microns in diameter. So that's the size, is actually one of the most important risk factors for cardiovascular morbidity and mortality. But it's also air pollution constitutes a number of other components, like other particulate matter, ultrafine particles, as well as gaseous components like ozone and nitrogen dioxide and sulfurs. So, and I guess the other thing is, what are the sources of air pollution? So the biggest source is fossil fuel combustion. But then, what do we get exposed to? In Sydney, for example, motor vehicle exhaust. When you have bushfires, agricultural burning. Even wood fires inside our home, those kind of things are air pollution that we get exposed to as well. Bottom line, air pollution increases cardiovascular mortality and morbidity. So it increases ischemic heart disease, stroke, heart failure, and arrhythmias, right? And cardiovascular death. So how it does that, you breathe air pollution in through your lungs, then it goes into the bloodstream. It causes increased inflammation and oxidative stress. It also can have a number of neural and endocrine pathways and other mediators after it gets into the bloodstream, and then it goes into all the different parts of the body. From the heart point of view, you get an increase in heart rate, you can get an increase in susceptibility to ischemia. From the blood vessel point of view, you can get increased constriction, increased blood pressure, problems with something called endothelial dysfunction. And then in the blood itself, you get increased coagulability, reduced fibrinolysis, and platelet activation. So these are just some of the many mechanisms, and all of these contribute to that increased cardiovascular risk of increased cardiovascular events like a heart attack, like ischemic heart disease, but also long-term increasing your cardiovascular risk factors and your susceptibility to developing cardiovascular disease. So both acute and chronic exposure to air pollution causes all these problems.
Okay, so it is a modifiable risk factor, like you said, so we can change that around us. Because I do remember, like I said, when I study cardiology and you look at risk factors for all those cardiovascular diseases, they tend to include smoking as a big one, and it really is. But we barely see anyone say, oh look, air pollution is one of the big ones, because it does cause that increased risk of mortality and as well as morbidity. That's quite kind of interesting for me. But now pivoting towards those bushfires that you mentioned, that how that can also lead to air pollution. And I want to get a little bit more practical here. So for someone sitting at home on a smoky bushfire day, because that is quite common in Australia, I would say, what are some real risks for their heart, and what practical steps should they take to stay safe?
Bushfire smoke increases your risk of ischemic heart disease, so it increases heart attacks, right? And increases stroke, and increases heart failure and arrhythmias, and that can occur acutely. All right, they've done studies where if you have a bushfire as well as you have an increased presentation of heart attacks. So for a person at home, get one of those air quality apps and follow it, okay? And if you've got, and then it will show you, moderate or hazardous levels of poor air quality, and so you stay indoors. And make sure when you're indoors, you've got good seals, close all the windows and all that kind of thing. Having an air filter at home is actually very useful. And then if you do go out, so avoid going outdoors, and if you do go outdoors, using a proper mask, like an N95 mask, okay? But you should be actually avoiding exercise outdoors, spending as much time indoors as possible, particularly on those high bushfire smoke days. And then avoiding any other sources of indoor air pollution, so like avoiding using a gas stove, for example, avoiding burning candles and all that kind of thing. And then just general health advice, keep up your medications, don't drink alcohol, keep hydrated, that kind of thing.
Sure.
Yeah.
So N95 mask, avoiding lighting anything on fire inside the house.
Yeah. Because you're just adding to that.
And not going outside, and having a air purifier if budget allows.
Yeah.
Okay, amazing. Sounds good. Let's talk a little bit more about a warming world, a warming Australia, heat and heat waves. So Australia is already one of the hottest and most climate exposed countries on Earth. That's been proven by science. How does extreme heat directly stress the heart? So
extreme heat is the single biggest environmental risk factor for death compared to all the other natural disasters combined. And the actual primary cause of death in a heat wave is from a cardiovascular event. Okay, so that's like a sudden cardiovascular event such as a heart attack or a cardiac arrest. Extreme heat has been shown to increase cardiovascular disease mortality and morbidity, particularly from ischemic heart disease. So from heart attacks, it increases hospitalizations from ischemic heart disease and coronary heart disease. And reviews have shown that heat waves in themselves actually are associated with an 11% increase in cardiovascular disease mortality. With the heat wave, the greater the intensity of heat wave, the greater the risk. In terms of the mechanisms, it goes back to what we're talking about pathophysiology-wise. So when you are exposed to extreme heat, your body has to cool down. So you need to, the heart has to redistribute blood to the skin and increasing sweat and cause more evaporation and redistribution of blood flow to the skin to cool down. And that means you have a lower what you call cardiac filling pressures. Your heart has to work harder, so your heart pumps more. You get an increase in heart rate, and particularly for people who have underlying heart artery disease, if you get this kind of what called supply-demand mismatch, then you get ischemia, all right? Yeah, right? But then other things that occur with heat are increasing coagulability with the heat and inflammation, and that can also cause acute cardiovascular events.
Okay. Now, in regards to heat and health, who would you say is most at risk? Are there any particular groups of Australians who should particularly be careful?
Yeah, so I think definitely, so the older adults, and anyone with underlying heart conditions, but also underlying any other comorbidity.
So just for the listener, what would you say is the age range of an older adult?
Oh yeah, I think more than 60, 65 is what they use. Yeah, but also young children are also vulnerable, as well as pregnant ladies as well. Outdoor workers, because they're working in the heat. But the other group, and those who are like lower socioeconomic groups as well, who can't, who have, don't have access to air conditioning or live in those kind of areas. The other thing, apart from just being vulnerable groups, there's also kind of vulnerable areas, and then there's other factors. For example, there's difference between Western Sydney and Eastern Sydney, right? Because of the temperature, you've got the urban heat island effect in Western Sydney, so they're exposed to higher temperatures. They've got more comorbidities as well, and so they're like, people living in Western Sydney are more vulnerable, right? Okay. And then in different parts of Australia are more vulnerable as well. You've got higher temperatures in certain rural areas and inland areas as well. The other thing to note is that we've seen a lot of these younger people, like athletes. Mm-hmm. So athletes is a big group that are particularly vulnerable to the problems of heat. Okay. Not particularly from a cardiac point of view, but it can occur, right? Okay.
Why is that? Why would you say?
So athletes?
Yeah, why?
Yeah,
why,
so Australia is quite a sporting nation. So, we've got people doing exercise outdoors, and so they're more at risk of developing heat-related illness. Like an example is the Australian Open recently. Mm-hmm. So they had such high temperatures. They do have this temperature thing where they have these high temperatures, and if it gets too hot, then they have to actually cancel the game. And a heat wave, for example, is where you've got 3 days of excessively high maximum and minimum temperatures. So the other issue is that the other big problem is if it doesn't cool down at nighttime, and you don't get that reprieve, and over a few days in a row, that's when people suffer more as well, right?
Okay.
And then the other thing I have to point out is that when you have a combination of heat and bushfire smoke, you actually have this synergistic effect where you have an even increased risk, which I think is important. So so that we're getting all these kind of multiple climate extreme weather events and occurring together, they have these synergistic effects to increase your risk of cardiovascular disease and other diseases more.
Okay. So I guess the big takeaway from that is if there's heat outside, if there's smoke outside, either one, stay indoors, but still train, still work out, still get that activity minutes up.
Yep.
Yep. Okay. All right. So next, let's move on to a little bit more about women, heart disease, and the environment. So you have a special interest in women and heart disease. There's a common misconception that heart disease is mainly a man's problem. Can you please take this moment to set the record straight?
So, ischemic heart disease is actually the second leading cause of death in Australian women. So it's much more, like people worry about things like breast cancer and other things, but it's actually, heart disease is actually much more of a problem than like breast cancer, which is actually number 6. So it's not just a man's disease. The main thing is that sometimes women present differently and present later, all right? And then we're finding out more and more. So women have a number of what we call sex-specific risk factors that increase their risk. So we're finding, for example, if you have any pregnancy complications such as high blood pressure during pregnancy, preeclampsia or gestational diabetes, that increases your risk of future cardiovascular disease. Certain other conditions, so autoimmune diseases such as rheumatoid arthritis that are more prevalent in women, that increases your risk of future cardiovascular disease. PCOS, endometriosis, all of those things kind of increase your future risk. So all these kind of female-specific or female-predominant conditions can increase your future risk of cardiovascular disease. And then you've also got these issues where there's other conditions that affect women more. So the big group is something called open artery syndrome. So you've got something called ischemia with no obstructive coronary arteries, or MINOCA, which is myocardial infarction with no obstructive coronary arteries, where people where the women have angina, or they present with a heart attack, but their arteries don't have a severe stenosis, like a 70% or more narrowing, that needs a stent. And so that condition is much more common in women.
Okay. Does the environmental burden, heat, pollution, climate stress, does that hit women differently? Or are there, like you said previously, gender-specific risk factors that we should be talking about?
So I think we've got sex-specific risk factors. I think environmental risk factors are just like another category of risk factors. So they do affect women the same as men in that sense. But women may be more predisposed. For example, women tend to be the ones that cook more. Okay, so they're more exposed to some of the, like if you use indoor gas and other cooking methods, like particularly in developing world countries where they use, they use, like a biomass, like some coal and all those other things, which are, wood smoking. They're really bad. So they're at risk of that, and because they do more of the cooking, right? So there's that kind of element of that. The other one, which I haven't talked about, is mental health. So mental health is a big non-traditional risk factor for cardiovascular disease, and in particular it is for women as well, so like things like depression. But one of the conditions that may happen, if you talk about environmental stress and like extreme weather events, is something called Takotsubo.
Yep.
So, and that affects...
Heartbreak syndrome?
Broken heart syndrome.
Broken heart syndrome, that's the one.
So for example, if someone loses their home to a flood, and they can present with chest pain or like shortness of breath, and then their arteries look normal, but they have this octopus, it's called like an octopus trap picture on the ultrasound of the heart, on the echo. So that's Takotsubo, all right? So it's like a stress-induced cardiomyopathy.
Yeah, right.
And it tends to affect females more, all right? It does affect males, but it tends to affect females more. But yeah, so that kind of mental health, with the environment causing problems with mental health, which is a huge problem. And then women do get affected by that kind of mental health issue, yeah.
All right, so next I want to move on to the segment, which is some practical takeaways for our listener. So these are things that they can actually start implementing today. So the first question I want to ask is, what is something that the listener can do to both protect their heart as well as the environment? If you could just give me top 3 things.
Okay. So number 1, plant-based diet. So red meat and processed meat increases your risk of coronary artery disease, cancers as well. But it also is associated with significant greenhouse gas emissions. So having more of a plant-based diet not only benefits your heart, but reduces emissions, from red meat and agriculture. So things like the Mediterranean diet and what we call the Eat Lancet diet also help with that. Number 2, increasing active transport. And so I think, you've seen recently, from this fuel crisis, so the increasing active transport meaning you're cycling or walking to work or using a combination of public transport as well as walking. That not only benefits your heart because you're exercising more, but also reduces transport emissions. So that's a big thing. Third thing would be increasing time in green spaces and what we call nature prescription. So there's a lot of benefit from a cardiovascular point of view and overall mortality point of view, cancer, mental health point of view from spending more time in nature and in green spaces. But also if we thought about like trees themselves, like deforestation contributes to worsening emissions, but trees, planting more trees actually reduces emissions. It absorbs carbon and it removes a lot of pollutants from the air. It also reduces the urban heat island effect by producing shade, and so that's going to help dealing with the heat as well.
Yeah, right. Yeah. So planting more trees and spending more time in nature.
Yeah.
Essentially.
Yeah.
Okay.
But I have to say, I have to add a fourth one, and that's changing over to renewable energy, because I think that is really important. So changing over to, trying to electrify everything from the electricity and cooling and heating, in your house. So changing over from a gas stove to an electrical stove, electrifying your vehicles if you can, but just reducing your reliance on fossil fuel energy and, using the sun and solar and wind energy, which is cleaner, better for the environment, and it's also better for your health.
There is a little bit of a tension here that I've sort of seen in the community, and that is individual behavior can only go so far. Do you think that the medical community and the governments here are doing enough on a systemic side? And that's something I feel very passionate about.
So the short answer is no. This is why I joined Doctors for the Environment Australia. This is why we've started. I felt I needed to kind of start doing something more. There is definitely a lack of awareness both in our own medical community as well as in the public themselves. And it is hard. Like it's quite unfortunate. And then in the government, from the kind of government point of view, unfortunately, they're not listening to the science. And I can go on about why, but I think most people take the analogy of fossil fuels companies are doing what the tobacco companies did with smoking. So I think it's up to us as medical people to realize, to kind of call this out. So back in the day when smoking was big, the tobacco industry did everything they could to try to make it seem that it wasn't a problem, right? The fossil fuel industry are spending billions of dollars doing the same thing. So I think, and that's a problem with that kind of lack of awareness with, with the government, but also with the public as well.
And you talked about being doctors and sort of taking action into your own hands to improve healthcare as well as improving the environment, especially here in Australia. Do you think from a healthcare system point of view, does anything need to change?
So unfortunately, yeah. So, with worsening climate change, we're going to have increasing demand on our healthcare system. And and unfortunately our healthcare system also produces significant greenhouse gas emissions. So in Australia, it's estimated at more than 5 to more than 7% of Australia's greenhouse gas emissions are from the healthcare system. And then you've also got the kind of the waste and the water issue. And a lot of this is, from hospitals, pharmaceuticals, and all the emissions embedded in the goods and services that we use. So when you've got increasing environmental stresses, you have increasing healthcare demand, but then the healthcare sector itself is increasing emissions. And so you're kind of having this continuous kind of loop that we're kind of contributing to the problem as well. So part of, so another big thing that we do is trying to reduce so healthcare sustainability is trying to reduce our healthcare emissions. And the Macquarie group, the sustainability group, we started because I was like, well, we waste too much. There was no one was kind of caring or doing anything about it. So, we started it a few years ago, quite a few, got a whole committee of different interested people, from nurses, people involved in the waste, people in the CSSD and all that kind of thing, as well as admin, to do all these little projects. The thing with sustainability is something that you have to kind of keep working on. The greener NHS, they got $1 billion to reduce their emissions to become the first net zero health system in the world. but they needed an army, right? And so you need a lot of people on the ground to be doing things. So, you know, we've had some good successes, like we got removed a whole lot of the plastic water bottles, and, you know, it might not seem a lot, but when you think about the hundreds of, I won't tell you how many water bottles that we used in Macquarie each year, you know, and all of them just go to landfill. You know, what a waste that is. You know, we've done things like reducing our clinical waste. So people were putting waste in the clinical waste bins, which require more emissions and energy to kind of get rid of that waste. That didn't need to be in there, so just educating about that. But, you know, and then just making people aware of the carbon footprint of, for example, ordering tests, like pathology tests, and, you know, multiple investigations, you know, thinking about what we call low-value care. So, you know, we need to reduce what we call low-value care. So 30% of our healthcare is what we call low-value care, and about 10% is harmful. Right.
Oh, wow.
So when you think about that, that's a lot. That's like, you know, repeated investigations or unnecessary investigations, and that is that has a significant carbon footprint.
How is that harmful?
So, you know, if you order, sometimes people like order a test and then it goes on to more testing and unnecessary investigations.
Right.
Yeah.
Okay.
Yeah.
So it's just finding false positives or things
correct.
like that, would you say?
Yeah.
Right, okay.
And then so that's like reducing that would, you know, reduce a significant, you know, apart from the cost, but also reduce significant emissions. And then the other aspect of sustainability is also reducing your the emissions from high value care. So yeah, reducing all that waste, reducing, you know, using sustainable procurement procedures, you know, reusing things rather than just throwing things away. Yeah.
Okay, sure. Can you tell our listeners what the Doctors for the Environment Australia is and why does it actually exist?
Doctors for the Environment Australia is turning 25, which is great. So yeah, so I think, you know, essentially we're the leading voice on health and climate. We're a bunch of, sorry, I shouldn't say bunch. We're several thousand strong voluntary doctors.
And medical students.
And medical students, sorry, that educate and advocate for the health and the environment. So we, you know, we do everything from, like, as you're doing, like educating the public, peers, about the health and the environment. You know, we advocate. So we talk to politicians, both at local, state, federal level. We do a lot of things like submissions that go into the government. And, you know, we work with all these different bodies and organisations in all these different areas, like sustainability, like air pollution, like mental health, all these kind of areas, essentially, you know, make sure we have a healthy planet for healthy people.
Yeah, right. And I think that's specifically important in 2026 with how things are happening geopolitically around the world.
Yep.
And we won't go into that because I think that'll drift away from this topic too much and we can probably spend another 2 hours talking about it. But what would you say is the most urgent thing you'd want every Australian to understand? So
we need everyone to realise that the environment and climate change is actually the biggest threat to our health right now. It is a significant risk factor for cardiovascular disease, and cardiovascular disease is the second leading cause of death in Australia at the moment. But all these environment factors affect not only just the heart, but every single organ of the body. So I think, you know, this is a big health problem, and it's only going to get worse, particularly with the ageing and growing population and worsening climate change.
So how can everyday Australians, not just doctors or scientists, get involved and support the work that you do?
You can become a friend of Doctors for the Environment Australia, so essentially just donating, coming to some of our, you know, some of our forums and some of our events. Learning more, Doctors for the Environment Australia website has lots of resources that you can read about and learn more about the environment and health. But then you can also involve yourself in other community groups, and we have collaborations with things like Parents for Climate. So my husband and I, my husband in particular, has helped with Parents for Climate launch something called Idle Off, which is a whole initiative about switching your engine off to reduce motor vehicle emissions, particularly when in front of school pickups. And then talking to your local, state and federal members, you know, just whether it's just writing a letter or even writing a letter to the editor, but actually meeting up with these representatives and talking about having that conversation that, you know, the environment is a significant problem to our health and that we need to do something about it.
Okay, so just being involved and raising more awareness.
Yeah, having those conversations I think is really important. I mean, I talk about this to my patients all the time, especially because I see a lot of patients, you know, during summer about heat, you know, about air pollution, all these kind of things. I think just bring it into that conversation. Yeah,
sure. And before we close, I have one last question for you, and probably the most important question today. If you could leave every person listening with just one message about their heart and the environment, what would it be? So your top thing to say about the heart and the environment.
Okay.
The most important.
So I'm just going to say, and I think I've said it before, but the environment and climate change is a heart attack, and there are many opportunities, however, to reduce this significant cardiovascular risk factor. But I'm going to leave you with a quote, actually. It's from Professor Leslie Hughes.
Okay.
And she said, the antidote of despair is action.
Okay.
And then another person has said, many people have said, and action breeds hope.
Okay.
So I think...
wow, that's beautiful.
So I think, you know, I think we know all this evidence. We just need to do something about it.
Okay.
Yeah.
Lovely. Thank you so much for taking the time out and coming and joining us today.
No, thank you for organising. This is great.
All right. Well, thank you so much.